Ladies and gentlemen, welcome to another episode of the Building Bodies, Strengthening Minds podcast. My name is Steve Warren, your humble host. I contribute very little to the program. I just kind of keep the bus rolling. These are the guys who make it all happen. We got to my right, Joe Sabusco. How are you, Joe?
Not bad. Yourself?
Yeah, very good, very good. It's, as we're recording this, fall is setting in. The Middle East is falling apart.
Yeah.
But it's an interesting time for sure. And certainly people are a little on edge on a lot of different things.
Oh, yeah.
And that's part of what we're going to talk about today. Tony Greco here, as always. How are you, Tony?
Doing good.
Yeah.
You got a message on your cell phone. You better turn your chime off.
I probably should turn the chime off. Yeah, of course. Yeah.
Doing good, though. Otherwise.
I apologize, fellas. I apologize. And our special guest today is Jeff Perron, Dr. Jeff Perron. He's a clinical psychologist, and he enters the fray to discuss, a lot of different topics today. Jeff, how are you?
I'm doing well. Thanks for having me, guys.
It's great to have you here today. And so let's begin by getting to know Dr. Jeff. Which do you prefer, Dr. Jeff, Dr. Perron? Which do you prefer? You like?
Oh, Dr. Jeff is great. Jeff is great as well.
Okay, very good. So let's get a little bit of your background as a clinical psychologist. You seem very young, by the way, to be a clinical psychologist.
I'll take it as a compliment.
All right.
I feel older every day. But no, in terms of background, so I did my PhD in clinical psych at U Ottawa. We were talking a bit about that before. But the work that I do is really with folks. You know, I am based out of Ottawa at a clinic called the Ottawa Institute for CBT, and a lot of work with professional folks in the area on things like depression, anxiety, burnout, workplace stress. So that's kind of my bread and butter on a day-to-day basis.
What are some of the common things that you're hearing from people that come to you for help?
Oh, I mean, it's often work in relationships are often the trigger or the spot where things start to flare up.
Right.
But it really runs the gamut. Like, it sounds so cliche to say, like, well, everybody's unique, but like everybody really is. Like, you can't just say, well, we're seeing this and this is the same for everyone. Everybody comes with their own reasons, and it's usually there's something that's not working in somebody's life, and it can really be anything. But how to get to the bottom of it and how to kind of put a framework on it, like I said, varies for everyone.
Is there the standard Hollywood layout where your patient comes and lies down on the couch and you just have a good old conversation? Is that how it goes down, or is it more like this kind of setting?
Well, I work from a framework called CBT, so that's my training. Okay. Do a lot of what's called schema therapy. And so when you're working from those frameworks, there's a structure. So usually we'll try to start with an agenda for each session. It's like, okay, what do we want to focus on? This might sound off-putting to some people, but there's homework at the end of each session to practice the skills. Yeah, well, yeah, there's overlap there, right? Like, you can sit and talk about the exercises, or you can go and meet with Tony for 15 minutes and learn a few things, but you know, you got to practice.
Serve espressos at your place too?
No, we don't have that down yet. But and no couch. Like, so with COVID, a lot of it, I'm virtual. A lot of my colleagues are primarily virtual. So different than what you might see on TV.
Yeah. Is there a crossover between Tony's world and your world? Like, to me, I've always thought when I exercise, my anxiety levels, anything stressful, we've always talked about it on the show, right? I mean, that's probably where the name workout got its name. You work out all the mental stuff. I just feel a million times better when I have workouts. Do you feel like there's, kind of synergy there between your two worlds?
Oh yeah, there is. And there's research on the benefits of exercise for mental health. Like, even like the movement, that activation, that's, part of what we work on with clients is like getting what we call behaviorally activated, right? So I don't know, like client wise, but I'm sure if we had kind of a crystal ball, I'm sure there's definite overlaps in not only what we do, but the types of clients, the type of people that we see.
Would you agree, Tony?
Yeah, definitely, for sure. Like I was talking to Dr. Jeff, and I mean, I worked with another doctor at the University of Harvard, and Dr. John Ratey wrote a book called Spark. I think I told you about this, and it was just how when you exercise, you think and feel better. That whole neurogenesis process of your brain cells thinking and regrowing. And I mean, especially in young kids, they did several studies. I'm sure you have several of them where they had these kids take these 15-minute breaks during school, and they just had them be active, like simple, like push your chair back from your desk, start doing jumping jacks, start doing body weight squats, and then they were engaged more in their ability to learn in their work. So that's just kids. And I mean, I just see it in my own practice where a lot of these clients, they come in, they feel good when they come in, but they feel really good and great when they leave. And because they're on a high, right? Like that, we talked about that runner's high. And I think it's just all the fulfillment they achieve throughout the workout that makes them feel good. And that's why I want to have Dr. Jeff on the show too, because, this is something that's important for people to understand. It's not about just exercising. It's about how you feel. And I see that more and more, like, those days of, hey, I want my ripped abs or I want my whatever sculpted body. Like, it's not really there anymore. Like, you don't hear it often. It's almost like they just come there to feel good and they know that it's good for them. And then whatever, if you look great, it comes with the hard work and the nutrition and the dieting and all that kind of lifestyle change. But the reality is that you feel better. It's your dose of feeling better.
Yeah. I mean, you live in that fitness world. Joe, you've got Lionscape, doing all kinds of exercise. I wonder, does the being chained to your desk world, does that contribute to people's anxiety versus something that's, because I think we're all hardwired from caveman days to be out there hunting and gathering and exercising. And now we're all just like gargoyles in front of our computers. Does that, do you think, contribute to the overall situation?
Yeah, exactly. And that's part of the problem, is not just, the city and what's going on physiologically, but if you're isolated, and we're very fortunate where we live, but, and we live in boxes, right? Like that's kind of the Western suburbia, is living in these isolated boxes. And so if you're spending most of your day in an office and then you come home and you live in this box, yeah, that's not great physiologically, but what else are you not getting? You're not getting some of that social contact as well. And if people might have seen this documentary on Netflix about these blue zones, these parts of the world where people live to be 100, right? So what's striking about each of those is there's such a community piece, there's a movement piece, right? And so a lot of what's good for the mind is good for the body as well.
Joe, you couldn't live behind a desk?
No. But you find there's more patients now ever since COVID?
It's interesting because we saw at the start of COVID, it was almost like everyone was on pause. Like, okay, you know what? This thing's going to be short term. Let me take a step back. And then sure enough, in, a few weeks, a couple months, we'll be back. So I'm going to take a break. And then after that, it was okay. Then the stress, the anxiety, a lot of the problems started, percolating in folks' individual lives with all the restrictions. We saw a huge increase. And I think that kind of pulled forward a lot of the demand for the services. And since then, things have kind of leveled off and gone back to baseline.
Oh, really?
And well, what's interesting is that's what we're seeing at the clinic level. The good news is that I think there's more out there. There's more great outlets like online modalities. There's, companies, and I can't speak for or against them, like BetterHelp is all online therapy, huge company out of the States. So people have more access to tools like this. There's more good tools. There's more bad tools as well. So, buyer beware. So I think that's, if we hadn't seen the increase in access and different tools, we'd probably be stuck in that kind of COVID-like phase of just massive, ridiculous, unfair wait lists. But, things have kind of returned to some kind of new normal, fortunately.
New normal.
Yeah.
So what about, everybody wants things done quickly. They're looking for the magic bullet, the magic pill, whether it's weight loss or getting in shape, or, maybe there's medication involved in getting healthy. Like, that's a difficult subject, I'm sure, in your world, like where, conversation and probing, with dialogue, when does that suddenly now we need to start giving way to medication? What's your thoughts on that?
In terms of the work versus the medication, that whole piece, well, yeah, I mean, the work for sure. Like there's no quick fixes. I think you can get a long way with insight, right? Like probably what you would see, Tony, is like, well, you can get a long way with some, removing some of the really bad habits and inserting some of the positive ones. But the work takes work. And we're not programmed to be happy. Like as humans, we're programmed to fight and survive. So it takes a lot of like work and insight and practice to change some of those habits. And then in terms of medication, folks, again, don't want to use the cliche of everyone's different, but that's certainly an option that people have on the table. Talk to their GP or their psychiatrist and get on a medication and explore that route. And definitely a lot of evidence to support the utility of something like a medication. But again, everyone's got to make their own decision on what works for them and the pros and cons of each option. But I'd say go and learn and explore. Like if you're not sure, if something's not going right in your life, start reading, researching. I'd say start sooner rather than later. Go see someone, talk to someone, whether that's psychologist, your GP. It's not going to be a quick fix. You might have to talk to several different people, try a few different things before you figure out what works for you, but start that process and get it going.
People are looking for shortcuts in your world for sure.
Yeah. I mean, I know that, going back to the medication, I've had a lot of patients actually off their antidepressants because they just were able to, I guess, get a clear kind of view of what they really wanted, you know what I mean? And again, I don't know the intensity of the level of their depression because obviously I'm not a doctor, but what I see is the level of their enthusiasm and just their well-being, how they're more like engaged, they're not distracted as much. They feel good about themselves. And I think, that they tried the medication. Some are probably still on and some are not on it. I know some of them that have been on antidepressants, like I said, and they're not on there anymore, but they do feel great. So,
what about for weight loss?
Well, for weight loss, I mean,
because there's some new stuff out there that, it's diabetic drugs that are now being used for fat loss.
Yes, I know it's crazy, but I mean, to me, any chemical that's taken into the body that affects it in some way, which is not a food, is a drug, and your body's going to react totally different to that. And I'm a big believer of well-being, making the right choices, eating the proper foods. I mean, there's diets out there, there's easy fixes. And I always said, I used to do consultations with people, and if I left a jar of, pills and say, look, you can take this pill if I leave, and you have 50% chance of, losing the weight or, feeling really bad about yourself, something might happen. Half the room would take it because they all want the quick fix. And it's just the way it is. But with every cause, there's an effect. So my theory is always about, look at yourself in the mirror, accept who you are as much as you can, exercise, make the right choice. We all have enough knowledge out there now to see what foods are the right choices. I mean, there's just so much data out there, and we all know what you have to do is eat a balance of protein, carbs, and fats, and hydrate properly, and everything in moderation. Base everything on body fat, not weight. That way, especially women, because they're hard on themselves. Look at yourself in the mirror. If you're in your ideal body fat and you look the way you are, then just tell yourself you're beautiful, because that's who you are as a human, right? You're not going to be that skinny mini person that maybe you want to be, because that skinny mini person is not healthy and maybe wants to look like you. So it just, accept, acknowledge, and adjust, right? And that's the battle that as a coach, as a trainer, we constantly face with people, because people don't know how to go through those obstacles. That's why they come and see people like ourselves, because we guide them. And then once they kind of understand what it's really all about, then they accept it. Like, first thing they do is like, oh, I got to lose weight. I'm like, what do you mean? How do you know that? Let's get you on the scale. Let's see how much of your weight on your skeletal system is fat, how much of it is muscle. Well, what do you mean? I got to lose 30 pounds. Who said that? And then it ends up being that maybe they have to lose 8 pounds, which might make them look like they've lost 30 pounds. You see? So people need to educate themselves on, what it is that they truly want and how to get it, and accept it, and see people for advice and motivation and expertise that are in that field. I mean, we wanted people to succeed, but we also want them healthy. I can give so many different diets to my clients and they'll lose weight, but I'm like, you're not healthy, right? I feel a little sluggish. Yeah, exactly. Because I'm diminishing your calories, or whatever. I'll do a high fat, high protein. Like there's so many little equations. It's like a math equation that equals 4. You could probably put 10 different equations that will equal the answer 4, right? But which one is really the right answer? And we all know that our body works on a 24-hour clock. We go 24/7. So if you drive that car 24 hours, you're going to need gas. Well, that's fuel. That's food. So you need to eat, but it's what you eat. And I mean, I
think it's how you eat, not what you eat.
Yeah, exactly. Yeah. Well, it's what you eat. No, it is what you eat, but you can eat a lot, but it's what you eat. Like, I mean, if you eat a lot of good food, like for instance, you can eat a whole room of green vegetables and nothing's really going to happen. Let's say this whole room was full of broccoli.
Well, that's what I'm saying.
You'd probably turn green, but so that's the issue. And the number one thing I see is the sugar. That's the thing that I think has a lot of issues that kind of affect the brain. Like now they're trying to tie this gut health to the mind. You probably heard more about that, where like the foods that have so many different chemicals affect the way your mind thinks, so they say the healthy gut thing, because when you feel good, you think good. I think you have this clear picture of what is it you're trying to do, what is it you're trying to be. But when you eat bad, let's face it, you're not going to, be in your best state, right?
Yeah. And I love what you're talking about, because you're talking about what are the habits that lead to health. Let's not put the 6-pack abs first. If that comes, great. I'm not fortunate enough to be quite there myself, but it's like we want to be healthy. Okay. Yes. Do you want to be healthy or do you want to be skinny? Because those are two separate things. And do you want to be happy or do you want prestige? They're two separate things. And that's something that I'm always working with clients and trying to go through the research on and kind of say, if you want to, like you're saying, if you want to be healthy, here are the habits, here are the practices. I want to do the same thing with my clients. Say, you want to be happy, right? So first, let's define what's happy. It's not just feeling pleasure and feeling awesome all the time. It's having meaning and purpose. It's like, okay, what are the things that contribute to that? What's in, what's out, and then work from there. Because a lot of the times the things that we think are going to make us happy, like the 6-pack abs, well, there's probably not very much good evidence that's going to suggest that that's actually going to make you happy. So get yourself off that path and work on a path that's going to set you up for success and that's genuine and sustainable.
Yeah.
I'm interested in the pursuit of happiness and that discussion because we're all so diverse. What does happy mean to different people? Some people just never seem to be happy. And the diversity of people, I wonder, when we're talking about happiness, are we products of our environment when it comes to that? Like, are there people that are just born happy, or is everybody, nurtured in their childhood in such a way that they're gloriously happy all the time? Are we products of our environment and our upbringing, or is it in our DNA?
Right. So it's partly, and it's funny because it actually is 50-50. Folks are high on positive affect and 50% are generally lower on positive affect. So I'm generally lower. Like I'm more prone to anxiety, stress. I'm not as prone to like feeling a baseline level of happiness or contentment. So that's fine. And the folks that I work with are generally in that 50% who are biologically low affectives. So that's
talking about yourself, right?
Yeah. Oh, yeah. Yeah. Like that's kind of my.
You know what you do for a living. Right?
Yeah.
Do you want me to explain what you do for a living?
Yeah. Well, there's a human side.
So, but here's the good part, right? Is it's not like, well, yeah, no. So you're biologically you're not happy. So good luck with that, and just accept it. And full transparency, like in my younger days as a clinician, I think like I took it this idea of accepting that, you're not directly prone to happiness. I think I took it too far to be some of that flavor of like, well, life's hard and, what you got to do is just accept it. And then I came across the research and the literature in this field called positive psychology, which is not about happiness per se, like not about the emotion of happiness. Yeah, that's part of a good life, but it's about, positive relationships. What are the things that contribute to well-being, like engagement, flow, feeling purpose in your life. And so those are the things, to me, I'd rather focus on well-being than happiness. Cause yeah, like 50% of people might go through their life and feel more like pleasure and enjoyment and quote unquote happiness. The rest of us have to learn how to generate that meaning and manage our mind and our psyche and our behaviors. And I personally, I'm biased, but I'd rather live that examined life and come to figure out what it is that I value and how to truly live that values-based, meaningful, purposeful life, which it's kind of like a sneaky roundabout way, actually leads to like positive emotions and happiness. But you have to go with kind of like the long way to get there.
I think people analyze too much.
Well, we're having a discussion.
No, I'm just saying, like all these studies and all of this, like you go back, my parents were married 54 years, they would have still been married if my dad was still alive. There was no studies, like nobody sat down and read books. You know what I'm saying? I think today there's just too much studies.
Well, they accept it. Doesn't mean that they were happy.
What did your parents talk about around the table?
You know what I mean? Matter. What do you mean? They weren't.
Well, they
look
at the old. I think they just.
Well, look at your mom and dad. How long they've been together?
They've been together, but they don't know any better, right? The back then, I think women just accepted being who they were, and the husbands would go out and they would bring in and basically be the providers, and
well, that's what men's supposed to do, right? Men are supposed to provide, no?
Yeah.
And women.
But I think there's like a good default and a bad default, right? I don't know if you guys have seen that the Blue Zones documentary that I mentioned, right?
I keep hearing people talk about it.
It's really cool.
You look at, there's this one in part of Greece, that an island in Greece where they're kind of isolated, so they haven't been quote unquote influenced by modern trends and modern products, etc. And their default is like a lot of community, a lot of just like good, enriching, nourishing foods, a lot of like physical activity that's baked in. Yeah. So like that's like a good,
people are overeducated
default,
today.
Right?
They know everything. And yet you talk to these people, they don't know what the fuck they're talking about.
Well, I mean,
everybody's so educated today. Nobody knows what they walk around like zombies. They need psychologists. They need doctors. They need pills. They need their weed. The weed shops are everywhere.
But I mean, you're hitting on something, right? In terms of like, there is something, I think, about the way we've structured our society where we've stripped out some of the meaning and purpose. And I think if we think back to like the glory days of the 50s, I wasn't born, but, I think there's probably a lot of like terrible stuff where people like push trauma under the rug and, were abusive and things like that. So I don't want to condone any of that. But I think we have like stripped out some of like the community and the connection and some like the default good behaviors and replaced that with like
a child needs a good spanking.
Ooh. Well,
there's research on it.
Well, what? That's not abuse.
I don't know. I don't know the answer to that.
No, what I'm saying, like today, you cannot address a child in any way, whether it's a good smack on the bum or a good yell, because all of a sudden becomes, they're sitting with you 20 years later and they got traumatized because my dad yelled at me or my mom smacked me on the bum.
A lot of them do have those issues from childhood.
I think those issues are created by today's society. They created. Were you smacked when you were a kid? We were all of us. We were punished as kids. We went to the corner. We went to our room.
That's why some of them.
But now you get that guy that you go, I feel a little off, and then they sit you down on a chair and they back you up. Like what happened to you 30 years ago.
I don't know if it's the absence of spanking, but it's being soft today generally.
Too soft.
I think right now, I mean, I don't necessarily want to come back to the spanking thing, but it's a case of,
discipline.
Following through. You can't just sit there and be watching your show or playing your video games. Don't make me come in there, that kind of thing, and just let it slide. Well, today we're trying to be their friends, and
that doesn't work.
We're skeptical of what the consequences are if we do give a slap on the bum or just.
Yeah, but what happened to you? What happened to you? You're okay.
Yeah, well, I was lucky. I turned out. I think.
No, but you're okay, right? You're okay, right?
Yeah.
There's always that percentage.
Yeah,
right. But that's in everything. There's
Well,
always that
I think we got to say what's the research say, and I think you're talking about like overcorrecting, right? And like overcorrecting on being like too gentle and too permissive. So we know like there's better ways of disciplining than spanking, but I think you're also saying that, and spanking is harmful. I got to clarify, but
listen, I'm saying a spank. I'm not saying a beating here.
right. But like I think you're talking about like overcorrecting, like everything's okay and like every feeling matters. Is like no, I agree.
Like house leagues now, soccer house leagues. There's no scoreboard.
Right.
Everybody's a winner.
Trophies for everyone.
Yeah.
How can that be?
There's research on that. Kids do have to learn how to lose and fail and rough play, right?
Yes.
Like that. You learn like, okay, I can't, be too rough with Tony because I'm going to hurt him, right? And that's how I learned the limits. Or it's probably the other way around, but, right. So yeah, I think it's a point well taken. I always come back to the research, right? On what's effective and what's not though.
I think society is getting too soft, too educated, and that's why we're having all these problems. That's how I see it.
Yeah, you can talk me into the soft part. I'm not sure about the education part. I think you can't have enough education. And if you're doing research that's based on good science and everything, then I think you're on your way. But
but people read bad things. People read bad research.
Oh, yeah.
People don't read
bad research,
and then they educate themselves with the bad stuff.
Oh, no doubt.
Everybody wants to be a doctor, but what's your degree? Everybody self-analyzes themselves and say, where's your degree? You know what I'm saying? Oh, well, I read it. Where did you read it? On my phone. Oh, okay.
Yeah.
That's
no,
fine.
there's bad information out there with people. There's bad information certainly out there on the internet. You see it in fitness all the time, just all the garbage science that exists out there.
This is what I'm talking about.
Oh, yeah.
People are too educated, meaning they're not educated like in the right way. They're not educating themselves the right way. Like you went to school how many years to educate yourself?
10 plus for
psychology. You read books and you read stuff like that. These guys, they print it on a telephone and they get their information in 10 seconds and they're all of a sudden they're doctors, like they're giving you advice.
Yeah, there's a lot of noise out there.
You know what I'm saying? This is what I'm saying. Like you hear people say, "Oh, take weed. It's good for anxiety. It's good for." Since when?
Yeah.
Since when is weed good for anxiety and all?
Because now it's a free world that. Again, I mean, it's the social part. Like for every good, there's a bad, right? So you're like, oh, look at that study. Then they'll contradict and say, well, look at this study compared to that. That's the other thing too. So there's not really anything super clear about everything because you could say, why is, just give me an example. You can punch in, why is caffeine good for you? And you'll get, oh no, caffeine's good for you. Then someone will say, why is caffeine bad for you? And you'll go, no, it's not good for you. And then you got the clash of opinions, right? But before you used to go to an expert and you would never question that. If you went back to your doctor 20 years ago and he gave you a prescription on, I don't know, some kind of drug, you'd go and take it. Yeah. Now you're going home, you're researching like, hey doc, you never told me this thing had, I was going to grow 2 heads or too late, so they get their backs against the wall because there's just so much out there, which is a problem. So that's why less is more.
That's what I'm saying.
Yeah, that's why you got to trust the people that you work with, I think, and...
you go see a professional and the professional is going to tell you what's wrong. You want to weight lift, I go see a professional. I'll go see you and weight lift. Yeah. People right now are self-diagnosing themselves too much, I find. And I think they're actually making their own cures.
Yeah, it could get worse.
Well,
it could get worse.
Not getting any better.
No, it could get worse because people, that's the problem with the society today is that like there's so much out there that people think they can do it, but they don't realize and respect the fact that people that have done this for several years and continuing to learn. Look at, I'll use me, for instance. I've been doing fitness for over like 25 years and I continuously learn more and more because everything evolves and changes. I mean, I spent the last 3 years changing my whole way of training, and totally different than what I used to do 20 years ago. And who knows, maybe in the next 3 years, there might be other scientific research and I'll be like, yeah, that's cool. And so I think you got to keep learning and analyzing stuff that is really benefit to like what you're trying to, get out of it. Right. I mean,
so there's bad information out there for sure, but we've got good information here today with our guest today. And I'd be curious to know,
you want relationships. I know you want to ask about relationships, don't you?
Relationships?
Because I think that's a big one. I think relationships, like you were saying, right? I mean, it's a big one with I only ask because I see that again in my field, right? Like you'll get either, the female, the male that comes in to feel better about themselves. Maybe it's not so rocky at home and, then they drift apart and so on and so on. Like, yeah, I mean, I'm sure you probably see that more than one, right?
Yeah, well, when we all bring our own beliefs and our own schemas and our own vulnerabilities to our day-to-day lives, and then when you're trying to have a long-term relationship with another person, you're blending those two belief systems, two sets of needs. I think we overestimate how difficult and complicated those long-term relationships are and how much work it takes to make that healthy, right? And if we have unhealthy, unhelpful beliefs or schemas, as I would call them, that's going to potentially set us up for whether it's picking the wrong partner or a partner that's not a good fit for us, or perhaps we've got the right partner, but we've got issues in the relationship that are percolating because our two belief systems are banging up against each other. So that's a huge, whether it's long-term romantic relationships and marriages is a huge part of the work I do with folks. Just relating to people in general, friendships. How do you relate to coworkers, colleagues, bosses at work? Relationships are a huge part of well-being and the work that I do.
When you pick some scabs, is there big screaming matches between partners and things?
Well, I don't do the couples work, right?
Okay.
For better, for worse. Okay. But I do I've got a lot of clients who are doing their own couples counseling, and then they're seeing me individually. But yeah, I mean, of course, we get into tough conversations, right? Like if someone comes to me and is describing they've got an unmet need in a relationship, well, there's got to be it's hard to even start a conversation a lot of time about how do I get my needs met, especially if it's a long-term relationship and you're bringing something new to the table. And then that conversation may or may not go smoothly, right? But that's, we talked about the work before. That's part of the work, and that's part of the hard part, but part of the rewarding part, especially when you're talking about long-term relationships.
The question I was going to ask you as we start to land the plane a little bit, that's all good. It's all good. That was a good question. But I wanted to ask you about the stigma of coming to see you, because I think this, there's that whole thing with, we got to talk about it. We have that big media chain in Canada that has the big marketing campaign that's kind of disguised as a mental health day and all that stuff. But it's healthy. It's good. Am I right in thinking there's still a stigma though, because I mean, that some people might say, I don't like Joe, for example. I can't see Joe, proudly announcing to Tony that he's going to see a clinical psychologist.
Never.
Right?
It wouldn't happen in my circle.
You wouldn't say it, right?
It wouldn't happen in my circle.
Yeah.
Never say never.
What would your message be to somebody who, like Joe, who's hesitant, who probably thinks in his heart of hearts that maybe I could use what the good doctor is offering here today? What would your message be to someone like that?
Yeah. I mean, first, you talked about like in some ways there's more awareness and there's less stigma, but I don't think that that necessarily hits each person the same way. Like I think we've done a lot in terms of awareness around suicide and suicide prevention. That's great. And that's super important. But most of the clients I see aren't going through suicidality. Some are, and some have, and that's part of the work that I do. But I think some of the newfound awareness can actually, if we're not careful, be isolating, because if we're saying, well, we're going to have awareness around schizophrenia, or we're going to have awareness around suicidality. If Joe's saying, I guess that's not me because I just got this like nagging issue with my kids, and I guess I don't see myself getting talked about in the ads and the campaigns, so I better just suck it up and deal with it. My message would be like, no, we're just having a conversation, and I think that I try to do a good job of like just it's just a conversation, like especially with some of the folks who might be stereotypically guys of a certain demographic, a certain age group, who feel particularly stigmatized. Like we're just having a consultation, and it's problem solving.
That's why guys like me don't go say, "Oh, he's profiling." No problem.
It's healthy for you.
I'm trying, Joe. I'm trying.
It's a problem.
Yeah. Any final thoughts before we wrap things up today, gentlemen?
Yeah, no, I was just saying like how, I mean, if you're able to kind of see when a person's kind of depressed, you know what I mean? If there's signs, you know, like if it's a habit that people do all the time, if it's like, you know, I that's something I wanted to see if you could actually see that, like what triggers that? Like, are you able to identify, to say something, you know what, this guy's depressed? And the reason why I asked that, because we have a friends group, and you know, like you look at the text, and I mentioned it to a psychiatrist before. I'm like, yeah, and he said, yeah, I mean, you know, is this guy this, right? I'm not going to mention. And I'm like, yeah, how'd you know that?
Go ahead.
No, I can't. And he said, well, you could see by the way they respond.
Just
I'm
on
like,
a text. This doctor saw it on a text.
I showed them my text of the group.
It's crazy.
That's how good the doctor was, right? And they're like, and I said, yeah, how do you know? Like, you know what I mean? And like, so anyways, based on the responses, they were able to see that there was some kind of like, you know, maybe depression. Like, do you see that? Like can you identify what people are doing if they're depressed?
Oh, yeah. I mean, we just look at the symptoms of depression, right? Like things like a lot of guilt-related thoughts, a lot of negative affect in how the person's presenting, their speech, isolation, you know, sleep difficulties. I don't know if you're comfortable saying, you know, some of what you're seeing with your friend, but I'm sure it lines up with, you know, the symptoms that we would go through in diagnosing something like depression. Yeah. Like a lot of like self-blaming thoughts, a lot of quote unquote negativity in people's thoughts and their assumptions and their outlook on, you know, what's going to happen in a given situation.
I'm interested now, just to dovetail on Tony's question, the people close to you, do they feel like they're being analyzed all the time?
Well, that's what people ask me when I, you know, was doing my training. Would always be like, are you analyzing people now? It's for like, well, no, I've always analyzed people, which is why, you know, I'm in this profession. So I think I just have a natural interest in like thoughts, people, ideas. And I think that's what has drawn me into the profession. So it's not I'm analyzing in the sense that I'm judging. Like, let's face it, we're all judgmental creatures. We do judge and we do all analyze. But for me, like when people ask about analyzing, it's like I'm just interested in like people's perspectives, their ideas, you know, where they're coming from.
So how much work do I need, you think?
We'll talk after.
That's a good place to wrap it up.
Yeah, no, that's all good. And I mean, I think Steve, you know, going back to the stuff like the fitness and the meditation and all those exercises you could do for your habits, I think Dr. Jeff would agree. I think it helps people to, you know, overcome certain things if they're not that far gone. Do you know what I mean? And that's just because experiences that people have shared with me. So I'm open to talk about it, that's what they did. So in order to like change the way they think, they got to be willing to accept the way they're thinking. And that's not easy, right? So if you start doing the daily habits, whether you're meditating, whether you're taking walks, early walks in the morning, whether you're exercising, you know, little things before, you know, maybe making that effort to go see someone like Dr. Jeff, like I think you could kind of, you know, maybe succeed and go through those obstacles, right? But you got to be willing to do the work, right? So.
And if you're not sure, like just ask. Like I know it's super hard to like reach out and talk to someone, especially if you feel hesitant. But like in my profession, we have certain confidentiality obligations, right? There's certain exceptions to that, but they're very limited exceptions to confidentiality. So if you come forward and you say, I want to talk to someone, try it out 1, 2, 3 sessions. A lot of people, especially in this city, are fortunate enough to have good benefits, probably be covered by insurance. So there's a very limited cost. Like do it virtually and you know, you're expending 3-4 hours. And even if it's not, even if the person you connect with isn't someone that exactly meets your needs, I think you're going to learn from those 3-4 hours invested and then go to the next thing and keep exploring and keep, you know, engaged in that personal growth.
Is there any information that we can put out there on your behalf? I saw a Substack, maybe a blog that you've got going. Anything else? Anything you want to put out there? to our listeners and viewers?
Sure, yeah. So I'm at the Ottawa Institute for CBT, so ottawacbt.ca if folks want to check out the clinic. And then, yeah, I've got a Substack where I put together written guides. So all the things that I talk about with clients in session, trying to put these together in these written guides that are detailed enough and clear enough that folks like my clients can go and read them and learn the skills so they don't have to listen to me rant in session. And that's a Substack called The Psychology of Happiness.
Nice. Well, it was great to have you here today and very nice to meet you. He is Dr. Jeff Perron. Thank you so much for being with us on the show today.
Thanks for having me, guys.
Thank you.
This guy here is Joe Sabusco. Have you learned anything today, Joe?
Absolutely.
Attaboy. Tony?
Yeah, fantastic.
Excellent. Ladies and gentlemen, my name is Steve Warren. Thank you very much for being with us today on the Building Bodies, Strengthening Minds podcast, and we'll talk to you next time.